Residents in Soweto finally have their own cardiac facilities. The Gauteng Health Department has granted the Clinics Health Group a license to operate a cardiac services facility at the Dr. S.K. Matseke Memorial Hospital in Diepkloof in Soweto. Here to tell us more is leading cardiologist at the health group, Dr. Martin Mper. Doc, good morning, and thanks for your time this morning. So I have to ask, why has it taken so long to set up such a service for residents in Soweto?
Well, it might have to do with the issuing of the licenses, because this is the first time that the license was granted to any private facility in a township in South Africa.
So what does a service like this, I mean, you started operating at the end of January. What does a service like this actually offer? What does it bring to the township?
What it offers is actually invasive interventions in patients with cardiac disease, which will include the type of investigations like looking at the coronary arteries, trying to open them, putting in pacemakers, putting in defibrillators, making preoperative assessments for those patients who will need open heart surgery, things like bypass surgery, valve replacements, and so forth.
So you'll be actually doing actual surgery?
The actual surgery is actually going to be possible because of that facility.
Now, this is the first private facility in a township in the country that offers this.
That is
so
correct.
who will be able to use these services? Who will be able to afford it?
So the affordability will be easier primarily for those patients who are on private medical funding, but we are working on models to try and make it more cost effective by putting together packages that can be affordable for most of the people. Of course, it will not be affordable for everybody. And the bulk of the people will still be relying on the public sector for those services.
Okay, so I mean, would there be a chance, and I know that I'm putting you on the spot here, but would there be a chance for you to probably take on some cases of people who can't afford or don't have medical aid? What do they call them, pro bono cases or things like that?
Obviously, with emergencies, the cost is not going to be an issue. The life-saving interventions will be ensured, patients will be stabilized, and luckily the facility is not far from Chris Hani Baragwanath Hospital, where tertiary services are also available.
Okay, so this is the first of its kind. Plans to expand to other townships, or it's just more like a let's see how this works phase for you?
How it works, it will work, it will be successful. Of course, there's a need for cardiovascular services. Cardiovascular diseases will be the leading cause of death, and it's already actually the leading cause if you consider the risk factors for development of cardiovascular disease, which is your high blood pressure, diabetes, smoking, and so forth. And those conditions are now overtaking HIV in terms of the cause of mortality and morbidity in South Africa and in all developing countries. And therefore, infrastructure that's going to make it possible for one to cater for patients that will be needing those services is actually a must. And this is the first in any township in private sector, and I'm sure it has to spread to all other townships.
So there aren't plans yet to build another one in another township? For now, it's just...
For now, this is the only one, and we'll see how it works, and then, of course, the model will then be expanded into other areas.
I see it's described as a hybrid cardiac theatre. What happens in a hybrid cardiac theatre?
In a hybrid theatre, it means cardiologists can do their work as well as cardiothoracic surgery. So you can do open heart surgery as well as minimally invasive cardiology interventions in the same place.
Wow, okay, so that's quite fascinating. And then I see here you also have plans to open the first day hospital in the center of Johannesburg. How, tell us about that.
The day hospital is more a clinics project, and that would probably also cater for cardiovascular services, but that is primarily a clinics project. I'm more the cardiologist who's the leading member of the team of cardiologists that will be partnering with clinics to offer cardiovascular services. Okay,
so you started on at the end of January. How's it going so far? Have you done any big cases, any big surgeries?
At the moment, we've done interventional cases on at least 2 patients where the blocked arteries were opened in the lab, and those patients managed to come in and they could go home the following day, as opposed to when those patients would have to go to Sunning Hill, Morningside, and so forth. So the primary objective is to bring cardiovascular services to the doorstep of the people living in Soweto, because the turnaround time, especially in those patients who get heart attacks, is very important. You need to be able to open a blocked artery within an hour to an hour and a half. And the time delay is what actually complicates the outcome in those patients. So we think a majority of patients are going to benefit, the ones that will make it to this facility on time.
And then the follow-up care is also done with you?
Yeah, the follow-up care will be done there, so they don't have to go anywhere else. And for the ones who will be in the hospital, of course, it will be easier for the family members to come and visit.
Okay, fantastic. Well, I wish you all the luck, and thanks very much for your time. That is leading cardiologist there, and Dr. Martin Mpe from the Clinics Health Group.